Hello, I'm Mira Halpert, founder of 3D Learner. In 1995, I started 3D Learner to be able to help smart, struggling students. And since then, I've worked with thousands of kids to be able to help them be successful. But for the last number of years, since 2008, I think, I've had the pleasure of working with Dr. Maureen Powers and Gemstone Foundation from Rodeo, California, to be able to integrate wholly into our learning program a visual skills program. Can you explain a little bit about what visual skills mean and why that's an issue with kids that might have learning or reading problems?
Sure. Of course, all parents take their children for regular eye exams, or they should. And when you do a regular eye exam, we find out that the acuity is good. The acuity allows the image to get to the back of the eye, but there's more to that, more to seeing than just having the image get into the eye. We actually have two eyes, and I brought my little friends, my two eyeballs here to explain this to you. We have two eyes, and glasses don't correct vision problems that have to do with the way the eyes move together. So there are issues that are concerned with, especially with learning, having to do with tracking, the ability to track the eyes across the page accurately, the ability to refocus the eyes back and forth, up and down the page, and especially the ability to converge the eyes from a divergent position where they normally are to a convergent position on the page that are important for reading.
So what is the incidence for students that have difficulty with reading?
Well, when they have difficulty with reading, often it has to do with not having the eyes point at the right place at the right time. And this isn't necessarily pathological, it can be a weakness, and so that weakness can be trained through practicing good eye movements.
And does this happen a lot?
It happens a lot in kids who are reading poorly. In fact, we've published results that show that there's a 50% chance if a child is reading poorly in high school, in the populations that we looked at in California, that they have a vision problem that relates to tracking or to the inability to converge the eyes properly.
And how does one find a problem? How would a parent know? I know we use a screening tool and that we certainly have the ability, but have you found that the screening tool, just that alone has been enough to be able to at least start to be able to look for an issue?
The screening tool is an identification factor that you can use effectively. I think that one of the most important things is for parents to observe their children while they're reading and to ask them questions, especially if they're reading poorly, about how their eyes feel when they're reading, if they get sore, if they get tired, if they see double especially. They need to first see their eye doctor, but then they need to come think about problems that might have to do with the ability to coordinate the eyes.
As I said, since 2008 we've had a wonderful relationship with you and your wonderful program, and have found some tremendous results. And the kids actually have really enjoyed doing that, and they actually found that reading was a lot easier for them to do. And at least that was a starting point for them to be able to start to then build on their reading skills. At least we now know their eyes are working together. For more information, please contact us at our website.